Hi, I'm Dr. Nicole Vane of Moonlight Beach Dental, and I wanted to invite a good friend of mine who's an expert in CBD oil and a fellow dentist, Dr. Albert Capati, who owns two offices in the Chicago area, to talk about his love and passion for CBD. He's an expert in my circles and definitely a mentor of mine, so I wanted to invite him to talk about the benefits he's found in incorporating CBD into his life as well as his practice. He's the one who has gotten this spark inside of me, and I really think it's a future cure-all for so many things. But welcome, Albert. Dr. Albert, you're awesome.
Thank you.
Tell me the name of your office and where you're located in Chicago.
Okay. Actually, I'm in Springfield, Illinois. It's a little bit away, actually closer to St. Louis than Chicago. But yeah, it's my general dental practice is called Capati Dental, and I also have a second sleep apnea and TMD practice, which is part of the Koala Center for Sleep Disorders franchise. So that's those are the two dental practices that I'm currently in. And my other business is trying to promote CBD in dentistry. And my other side business is I sing in a wedding band. So I've got a pretty full life.
Yes, yeah.
I'm a little busy,
No, you didn't intend to start selling the CBD. It kind of came to you roundabout because there was such a demand for it that you found in your practice and through your friends and in talking about it. Is that correct?
Well, there wasn't really a demand for it, more so that there was that I found out about this product and I used it myself, and then I just realized it was perfect for dentistry. It was just it helped people's mood, so it helped allay people's anxiety. It also helps with pain and inflammation, and I take it to get better sleep. I can go to sleep easier, and I don't wake up in the middle of the night, and I just wake up so much more refreshed than if I didn't take it.
Yeah,
So,
I've heard that from so many of my patients who either have a restless mind or other issues with sleep, that the CBD oil just gives them some of the best sleep they've ever had.
yeah, and sleep is so important to everything. Your body is healing. If you're not getting deep enough sleep, you're not healing. You're feeling pain more. You're making worse decisions. So yeah, this is my sleep center talking. Yeah,
We should have another meeting about that soon to talk about the benefits of doing sleep treatment and
mm-hmm.
how CBD can help with that, because I know you're an expert on that as well.
So, yeah.
Now, you're the one who I reached out to when I wanted to start using CBD in my practice because of our hemp oil and medicine and dentistry group that we're in.
Mm-hmm.
So all my discoveries about CBD have been through you. So everything you said has been phenomenally true, and then some, exponentially. But do you mind just telling people how you discovered CBD or what intrigued you about it?
Okay. Yeah, my parents actually introduced me to it. It's kind of weird because I grew up very, very, I don't know, in a straight-laced environment, and so cannabis was the furthest thing from my mind. But my mom developed Parkinson's disease, and she was diagnosed a few years ago, and she was having trouble getting to sleep, staying asleep. Because of her movements kept on waking her up, and she found that she couldn't get back to sleep once she was up. So everything was, she was just kind of miserable from that. A doctor friend of the family, she's an oncologist. I'm not sure how she got into it, but her doctor friend introduced her to it. But she was taking it to lower her blood pressure. And it was having good effects there. So she said, "Hey, maybe this will help with her sleep and maybe possibly even the Parkinson's." So gave it to my dad. My dad was like, "I don't know about this." So kind of skeptical about it. just kind of held on to it for a while, didn't do anything. But my mom just continued to have these problems sleeping. Finally, my dad gave her some hemp oil, and then she slept. She slept really, really well. So she's been taking it ever since and sleeping really well and sleeping through the night. So it's been really helping her. And she's upped her dose since then, trying to treat the Parkinson's part of it, and hopefully she'll be getting some good results there. So so my mom knew that I was, with how busy I am and how stressed I am, knew that I wasn't really getting quality sleep. So she said, "Hey, this isn't working for me. Why don't you give it a try?" So yeah, I was on vacation with them at one point. So I took it. I got some really good sleep. But I was like, maybe it's just because I was on vacation. So I got home. I got another bottle of it. This time a month-long dose of it. So I got 30 doses of it. Gave that a try, and so many good benefits. I slept better than I have. Like probably, I remember sleeping this well back in high school. Probably, college. I was falling asleep in classes, and dental school too. It's a surprise I'm actually here, being a dentist graduating. But so I had horrible sleep all throughout my upper education levels and into dentistry, and then I started gaining weight and stuff. I actually started taking this. I lost 15 pounds within that month. I don't know, it's because of the CBD is a little bit of a appetite inhibitor, or it's just the better sleep that I was having, less inflammation. I don't know, all those factors. I was feeding my starved endocannabinoid system, and things were happening and things were good. So I was feeling more energy, less stressed. My staff noticed a difference in me, like just being a nicer guy, I guess, less crabby all the time, less
It's
sleepy.
funny, we're used to being like super high strung, right?
Yeah.
I know. I think about it that way too. Like when I've taken it, I don't have anxiety, but I am stressed, and it's my norm. And I tell my patients about it so much now that sometimes I'm like, shoot, why have I not taken any today? And I'll take some. And the way I describe it is it feels like I've had a couple glasses of wine without any of the effects of feeling out of it in any way. I feel super sharp, alert, but I just feel relaxed. Like I just can get through anything a lot easier. It just takes the edge off.
That is, a lot of people have described it that way. And yeah, I can take it. I can do dentistry. It's not impairing my abilities at all. In fact, I think it's enhancing them as far as I can be more calm. I can be just more focused. It doesn't make me drowsy. It doesn't make me drowsy when I take it at night either. It just allows me to go to sleep. I intentionally say, okay, I think I like to go to sleep now. And I do, rather than just tossing and turning all night, worrying about stuff.
Yeah, I know what you mean. I don't feel drowsy or anything at all either. And I had a patient that helped her so much in treatment. She bought some, and then she was texting me the next day, I have a big presentation at work and I'm super freaked out. Can I take it before? And I'm like, yeah, take it before. It's not going to make you stumble on your words or do anything that can be harmful. It only just helps relax you. Now, can you explain how the endocannabinoid system works? Like the more I read about it and hear about it, they're saying that for thousands and thousands of years, this was always a part of our diet or part of our system that we have just started to ignore culturally. It's not in our foods aren't the same, our diet's not the same, but that we used to have access to this endocannabinoid system. Can you describe what that is?
Okay, yeah. So there's a system in the body called the endocannabinoid system. Obviously, it's named after cannabis. They were trying to research why marijuana had such a varied effect on the human body. And then they found a couple of receptors, the CB1 and the CB2 receptors. The CB1 is more in the brain and the central nervous system, and then the CB2 receptors are more in the peripheral organs. So this system, this communication system, depends on endocannabinoids. Cannabinoids are substances that the body makes that binds to these CB1, CB2 receptors. So so the body has to be able to make these endocannabinoids, namely anandamide and AG2 or 2AG. and the body can't make them if we're not giving it the right nutrients. So whether it be phytocannabinoids, plant-based cannabinoids that we can ingest from hemp or marijuana or other things that would help feed our endocannabinoid system, or just the regular vitamins, omega-3 fatty acids, just a healthy balanced diet that we're not getting because of industrial. I don't know, it could be from anything, but I think our farming methods have really depleted our nutrients. So I think our bodies are just starved for nutrients, and a lot of the ailments that we've had that are becoming epidemics now are born from this deficiency in nutrients that we're having, and especially the phytocannabinoids like CBD and CBG, CBA, all the stuff that we can get from stuff that's been banned because of ignorance, basically.
Yeah. It's so interesting you said that too, because as you know, they're now saying that addressing the CB2 receptors, you're saying, is what can help detox people. So people with a lot of autoimmune diseases, now they're finding that reactivating the endocannabinoid system is going to help them detox and then flush out some of these inflammatory pathways that are leading to autoimmune disease. And I think that that's really interesting, because I just thought it was cool for sleep and anxiety. But if it actually has a true health benefit and repriming your body to heal, I think that that's fascinating.
Mm-hmm. Yeah. I mean, just the deficiencies in anandamide itself, that's the bliss molecule. It's found in chocolate. It kind of gives you that the runner's high. So all that is kind of activated by that. So if you're not creating enough of that, you're not, you might not be feeling as good as you could be feeling. So yeah, there's definitely like the good thing about all this attention that CBD is getting is that it's going to make it more legal, more easily researched now.
Yeah.
So you had to go through tons of hoops in order to get certain the materials to actually do some research on it, get all the permissions to do it, and now it's going to be so much easier. My state of Illinois the governor just a month ago or so signed legislation that farmers can actually grow industrial hemp now. So it's going. The farm bill, the national farm bill is going to be has some language about hemp in it that will hopefully take it off of Schedule 1. So
yeah. Now tell me, like, the concerns that people would have. Like for me, I'm just like an anti-drug person. I don't have the personality. I've never really wanted to try anything. Wine's as fancy and adventurous as I get. But so I was like, ooh, THC. So that anyone like me is thinking, well, I don't want to be drug tested. I don't want to have any psychogenic effects or anything that's going to make me feel weird. So can you explain what THC does or how it's not in the hemp oil?
Okay. Yeah. So yeah, like you, I've actually never used marijuana in my life. So I'm like the least likely person to be talking about this.
Me too. Yeah.
It's kind of funny that I've ended up being an expert in this because, for most of my adult life, I've been just saying no. I've just been saying I've been against, illegal drugs and for legal drugs, and it seems like the legal drugs are causing more problems than the illegal drugs now. But anyway, so THC, a lot, not like you and me, I don't want to feel the high. I don't want to be out of control. So and there's a lot of people out there that would love to have the medicinal benefits of cannabis without having to deal with a high. So the high is produced by the phytocannabinoid called THC, tetrahydrocannabinol, which is found mostly in the marijuana plant. So marijuana and hemp are different. They're part of the same family, cannabis family, but they are two entirely different plants. While marijuana is higher in THC and lower in CBD, hemp is very high in CBD and extremely low in THC, to the point where I heard that you have to pretty much smoke an entire football field worth of hemp in order to get high. And
Okay.
so yeah, it's impossible to get high off of hemp. And but the definition of hemp in the United States, legal terms, is that you cannot have a concentration of THC more than 0.3%.
Okay.
So yeah, there can actually grow a hemp plant that would, if you extract it, you can get THC above that. So you got to be really careful of your sources
Yeah.
of your hemp and your extraction process, because that you've the product that I take, there's 0.0% THC. I don't know how they do it, but maybe it's in the extraction process. I wish I knew a little bit more about about how they did it, but no one has tested positive on a drug test after taking this. But other CBD products, I can't guarantee that.
Yeah, yeah, I read that as well. And it's funny because like my whole group of, even though I went to Berkeley, all my straight laced friends that I hung out with, they're now all high stress too. And some have taken to like taking gummies or edibles. And even though they're low dose THC, again, you are getting THC. And then one had this, it was a very hilarious story, but she had about a gummy bear sized portion of a cookie that had supposedly limited amounts. They were taking it for CBD type effects, but she ended up extremely high. And it's even funnier if you know the person that she is, that she's very conservative, whatever. So I would have liked to have been there to see it, but I kind of wanted to assure people that the CBD you use, Ultracell, and some of the other brands don't give you any of those effects. And the reason I started carrying it in the office wasn't for profit. Just people don't know where to buy it. And like you said, I don't want them buying bad stuff, or if you go to the dispensary, it's a lot less, but they do have, most of the tinctures have THC, and they're also not necessarily extracted well. Like the product you use, Ultracell, you said is organic. Is that correct?
Right. Yeah, it's organic.
What are the benefits to having it be organic?
So one of the benefits of hemp is that it absorbs all the nutrients from the soil, but it absorbs everything from the soil, including toxins, pesticides. So if you don't have a good source, if you're having a pesticide-laden field of hemp, that plant is going to be absorbing all of that really well. So so when you make an oil out of it, when you extract things out of it, you're going to be getting all those toxins. So so you want to be as pure as possible. And right now, the only real purity factor that we can count upon is organic right now. And so organic, you don't want, also the extraction process is a good way too. So there's some that use like benzene and chemicals to extract CBD and other things from the plants. The Ultracell that I use is basically based on pressure. Let's say they use highly pressurized carbon dioxide to extract the oil out of the plant. So it's nothing unnatural in that process. So
Now, the other benefit to it is that it's water soluble.
Right.
Correct? So
right.
Can you explain how that affects absorption of the product also?
Mm-hmm.
Not only is it cleaner, but you want to know that you're actually getting the full benefit of it.
Exactly. So yeah, this is the thing that differentiates Ultracell from other products, is the absorption rate. It is hemp oil. It's an oil. The body can't really process and absorb oils very well. We're mostly water. So it's just like the problem with fat-soluble vitamins. It's hard to get those in the body. You take a bunch of vitamins, it ends up just going out of your system. So you're not absorbing that much. But there are ways to make an oil more absorbed. There's micelle technology, and there's liposomal technology. I think Quicksilver uses some sort of nanotechnology to get it even smaller, so it's more absorbable. So there's ways to increase the absorbability. These are processes that probably took a lot of research and development to get into. So a lot of the regular companies don't have that type of investment into that technology. So one way to increase absorption a little bit, hemp oil by itself, you're looking at about 3 to 6% absorption rate. So if you take 100 milligrams of it, you're only getting like 3 to 6 milligrams into your body. You're only using that much. So you can increase that by mixing it with several oils that are more soluble, like avocado oil or coconut oil, using them as carrier oils. And that can get up to maybe 10, maybe 12%. But ultrasound, there's been a study done by the at the Mayo Clinic that it had it above 90, actually up to like 94%. So
Wow.
that's 30%, 30 times more than other products. So, and the water solubility not only gets more absorption rate, it's the quickness of it. The onset of action is a lot faster than what you would if you wouldn't. So you place it underneath your tongue, and that's where the body has most access to the blood vessels, and you can absorb it into the bloodstream a lot faster. And yeah, for my patients, we got probably about 3 to 5 minutes. I see them feeling a lot more calm. I'm not sure what you've been using it too, so
yeah. I'd say about that.
Yeah. So I'm waiting with nitrous oxide. Sometimes I'm waiting as long as 10 minutes for them to titrate to the fine point of where they're feeling good, and I'm not overdosing them on nitrous. So
I actually had a couple people recently who weren't feeling any effect on nitrous. And I like conscious sedation also if someone really wants to be out of it. When they don't want to be out of it, I just suggested we use CBD instead. And both of them, their second visit, declined the nitrous and said they preferred the CBD. The CBD did have that final, it kicked in where they're like, oh, wow, now I really feel something. Now I feel really relaxed. In fact, one of my friends, I kid you not, her exact words were, today's the best day of my life because I actually feel, for the first time in my life, relaxed at the dentist. Even though we're friends, that didn't help. It was that she took CBD. She bought some. She's the one who wanted to use it on her presentation the next day. Because she said it's the first time she just felt not just at the dentist, but in life. She's a high-strung person. Mm-hmm. So she's like, this is like magic potion. And I thought that was really powerful just to see someone instantly. It was probably within 3 minutes. She just went took a big sigh and was just like, all right, I'm good. This is awesome.
Yeah. So, perfect for dentistry. This is just, it's kind of like a no-brainer. Once I realized this, I'm just like, yeah, I need to share this. I need to get this going. I just need to tell more people about it. I searched for dentists that were using it, and I couldn't find any. There weren't any. I couldn't find it. There are probably some people out there, but as far as making, and I'm pretty good at Googling, and I couldn't find any dentist that was using it. So that's why I created the Facebook group, Hemp Oil and Dentistry, and just people.
And thank you for that, because it's just been really, really career changing for me as well. Now, how do people get in touch with you if they want to come to your practice or if they want to find out more about ultrasound? How do they get in contact with you?
They can go to, I'm trying to make it easy. The best way to contact me is through Facebook, actually. Just look up Albert Capati on Facebook. I basically accept friends from pretty much anybody.
Okay. How do you spell your last name in case someone is challenged phonetically?
Albert Capati. That's ALBERT CAPATI.
Okay.
That's also my Gmail address, so albertcapati@gmail.com. So you can reach me through there. I'm starting up a new website called hempdentistry.com. It's just the bare bones right now. So if you want to get on our email list, then you just go to hempdentistry.com, and there's a little form that you can enter your email and name and keep you updated on that. But yeah, that's what I'll be doing. I'm trying to launch that to help dentists incorporate things CBD into their practice.
And what do you tell patients who say the price point's a little too high? Because it's over $100, correct? for
Yeah, for sure.
1 month supply. So
Yeah.
what would you tell them? Because I mean, I see the value in it. I think it certainly replaces in some of my friends the meds they were already taking, the people who I know taking Xanax or Tylenol PM or whatever. It's actually probably cheaper and better for them. But what would you say to them about that?
Well, in my practice, I try to get over that by offering it by the dose. So I charge $7 per milliliter. So they can get a taste of it, and it tastes good, by the way. This is like the only CBD oil that I've tried that actually tastes good. But
I like the berry flavored one. Yeah.
Yeah, that's a favorite. I'm always running out of berry. And then if they like that, then they can go home they can buy a bottle of the 7 milliliter bottles. They created something called the Ultracell Challenge. It's like a 7-day challenge where you take it for 7 days without trying to change anything else about your lifestyle. So any changes that you notice would be most likely from the product. So that's $40 to $50 depending on who the ambassador that's selling it. So they can try that, and if they like that, then I offer a little coupon for that. They can fill out a questionnaire about their experience on it, and they get $10 off of the month-long dose of it. So I sell it for about $140. So they would get $10 off of that. And so yeah, I think you need to take it and see if it works for you, and then see if it's worth it to you to do that. Because if you take it for a month and you start to drop some prescription medications, and also treating the side effects from those. So if you really look at it, you might be saving money overall. And plus, it's a huge. If you're taking multivitamins and a lot of other supplements, hemp oil is like chock full of nutrients. It's got so many. Some of the doctors in our group call it God's multivitamin because it just has everything in it. So you can decrease other things by starting to take this. So I think it's worth it, and plus it's even more worth it if you become an ambassador with the company that makes it, Zalise. You can buy it in quantity for insanely lower prices. It's got like a shelf life of 2 years, so you can buy in quantity at one time and just get it for like a third of the price that you would get.
So if you bought it in quantity, you might be like, I don't want to rep it, but then my dad needs some, and then my girlfriend needs some, or my sister, I'm going to send her 2 bottles. It costs, you can pass along the discount to them, and essentially be buying it for yourself, for your personal use and the use of your family, versus selling it for a markup price. So yeah, that's such a cool idea. Well, I'm so grateful for what you're doing, and I appreciate your time for us to chat at a distance. And I just think what you're doing for dentistry and getting the word out and all this is freaking awesome. That's great.
Thank you. Yeah. I admire all that you're doing too, and we seem to be doing a lot of the same stuff. So this is really cool to have somebody go through. Like we're doing laser dentistry now.
We're killing it. That's awesome. I know. We'll have to do another one on the snoring and the night lays and sleep apnea. We'll have to get together for another one of these chats. But dude, fist bump to you. Fist bump. Keep up the good work, and we will talk soon. I appreciate your time.
Great. Thank you very much.
All right. Bye, Albert.
Bye-bye.